Hello, this video will provide answers to the age-old questions about breathing and speech with an emphasis on stuttering. Stuttering is the thing in speech pathology where breathing gets the most attention, the most suggestions, the most advice. Right now what I'd like you to do is place your palm on your chest. 1, 2, 3, 4, 5. So I'm asking you to count out loud to 5, never taking a breath first. 1, 2, 3, 4, 5. If you did that accurately, you just said 5 words without breathing. So we just broke a myth that taking a breath is a necessity before talking. Let's start with science and then move to how breathing actually plays out in your anatomy, especially if you stutter. So as we talk about speech science, how does a person breathe? We know that a person's supposed to breathe from the diaphragm. The diaphragm is a sheet of muscle at the bottom of the lungs. As it goes down, air gets pulled in by negative pressure. It reminds me of a bellow, how you pull in an air. So the proper way to breathe is down here from the diaphragm. What if I told you that one of the biggest myths in stuttering treatment is that you have to take a breath before speaking? There are countless speech programs that are predicated on the necessity of taking a breath before speaking. Many of those programs also say if you begin to stutter that you're supposed to take a deep breath and then use a technique. The idea that you have to take a breath to talk and the idea that you should inhale before and during a stutter are both false. Let's return to our exercise. Now we're going to go to 8. 1, 2, 3, 4, 5, 6, 7, 8. Now we're at 8 words, never taking a breath. I can go to about 25 before I'm in distress and I want to take a breath. How can a person begin to talk without breathing? We need to understand what PEEP is. Positive end expiratory pressure. That's a tongue twister. It's the positive pressure in the airway at the end of expiration. What that means basically is the fact that my lungs and your lungs are open right now is the positive pressure inside the lungs called PEEP. So right now, think of your lungs as a couple balloons. I have air to begin talking. It's there already. Now, if you've never stuttered, this doesn't seem important to you. We all have friends that can talk with their hands, they can go really, really quickly, and they're demonstrative, and they're visual, and they can talk really quickly. It doesn't matter. But if you stutter or treat people who stutter, the understanding of breathing becomes very, very important. I had a severe stutter through undergraduate school, and I know a little bit about blocking. Anyways, we need to move now into panic, fear, and anxiety as it relates to breathing. We know that people who stutter anticipate stuttering. Many fear stuttering. They have to do an interview. They have anxiety about stuttering. Stand in front of a room, go around the room and do intros. These are the type of things that can oftentimes cause panic and anxiety within the person who stutters. During the perceived danger, don't stutter. I don't want to stutter. I don't want people to find out I stutter. During that feeling of danger, the amygdala sends a distress signal to the hypothalamus, which is a command center that communicates with the rest of the body through the nervous system. The hypothalamus controls involuntary things such as your heartbeat, your breathing, and your blood pressure. So when you feel panic, anxiety about stuttering, it affects your heartbeat, breathing, and blood pressure, creating something you've heard of as the fight or flight response. During the fight or flight response, your diaphragm tightens, blood leaves your extremities, making your body ready for action, fight or flight. It's like a panic. During the fight or flight, when the diaphragm's tight, we tend to work off shallow breaths high in the chest. Those create that nauseous feeling, that fearful feeling that's sustained as long as you stay in it. Now, when you're in this situation, you have a lot of anxiety and you're stuttering. If someone suggests to you, take a breath, in a moment like that, you may fuel a bigger stutter because you're filling this anatomy with air. And remember, a moment of stuttering requires air and muscular tension, two ingredients. So it's like you're providing air to a fire that you're trying to put out. Some people will defend breathing, say you have to breathe before you talk, you should take a breath during stuttering. And then what they'll say is, well, I suggest that people first take the breath, then relax, then use techniques A, B, C, D, E, F, G. Some people will say, but if I have a big stutter, I have to take a breath. And I want to demonstrate here. I'm going to hold a stutter for 10 seconds, which is a pretty long stutter. And then I'm going to release the stutter as I exhale, like this. Did I need to inhale to come out of the block? No. What if I would have stopped and inhaled? And what if I'm panicking because I'm worried about my stuttering for my audience? So I stop the stutter, I take a deep breath. If I have anxiety in my body or the fear of stuttering, I will likely create the next stutter. So since the inhale in the middle of the block is unnecessary, remove the variable. Remove the source of fuel, because if you inhale during the block, you will create a larger block with more secondary symptoms. I do want to acknowledge and respect anyone who's gone to a program where breathing was a core of the program, and that individual who stutters has done very well. I know people like that, and you might also too. If you know anything about shooting, an arrow or a firearm, you find the crosshairs. Once you're ready to execute, you begin a gentle exhale, and then you act. It's very much like talking. If somebody asks your name, they call on you suddenly in a classroom, I'm telling you, you want to start as you exhale. Look and let it out. Look at your listener and let the word out. If you begin talking as you exhale, you'll either be so patient there's no stutter, or you'll have less energy in the stutter. The stutter will loosen and come out easier. We all want to stutter more easily, don't we? Moving on, let's use an example. I get called on in class. What should I do? You can start on an exhale. Look at the person talking to you. How about reading? What do we do about reading? We'll have this passage marked in phrasing, and it has the lines in the text. You begin reading as you exhale, and then for me, about every 2 phrases, I take a micro breath from my diaphragm. My mind was going 1,000 miles an hour, and my mouth would say whatever came to it. When you finish this video, I want you to immediately watch a video of myself and a young man named Parks Kaiser. Parks Kaiser went to therapy for years with different individuals who told him to take a deep breath. And I want you to watch the result of that teaching. he would take a deep breath before and during his stutters. His head would go back. So the deep breaths, you're going to see very clearly in the video that a deep breath immediately before and during the stutter creates severe stuttering. And then watch as we work together, including some work in the mirror, to get the talking on the exhale. And remember, all of your classic techniques like pull-outs and easy onsets should be done in unison with an exhalation. It just makes sense. So breathing and stuttering has been something that we've talked about for generations. And during this video, I hope I've made it very clear to you that a human being can begin talking on an exhalation without taking a breath because of something called PEEP. If you begin to stutter, the last thing you want to do is inhale and fill the chamber. The layperson, a teacher or somebody, may look at a child who's blocking and say, stop and take a breath. It's very common because they don't understand. It looks like the person who's stuttering needs the breath, but it's the opposite. Thank you very much.